good friend Dr. Joe Congini, Akron Children's Hospital, with us in studio. Joe, Mike Clevenger, word came down, back strain. He left the game the other day in the fifth inning. Now we're seeing 6 to 8 weeks, and they're saying he's not even picking up a ball for the next 6 weeks.
Yeah, that
Talk
surprised
about a
me,
back
too.
strain.
I saw some of that game Sunday. Oh, my gosh, our pitching staff is great, but Clevenger was the best of the best.
Yeah.
How could he be so overpowering and stuff like that and then have a significant injury like this? So everybody's scratching their heads. I have to admit, a few things about yesterday's announcement, even in sports medicine, has me scratching my head. So I want to talk about it kind of two ways, what this injury might be, but also why this happens sometimes as we talk about 6 to 8 weeks. So we're talking about even Tito and the Indians' release yesterday, very significant injury. Those are Tito's words. Yeah. And they say injury to the teres major muscle. So here's the deal now. Nowadays in sports medicine, you're getting an anatomy lesson every week.
Yeah.
We don't go around diagnosing people with teres major muscle injuries in my office very often, almost never.
What's the teres muscle strain?
So I spoke to one of the real senior orthopedic surgeons in sports medicine. I said, have you ever made that? I've never made that diagnosis. So here's a little bit of why that is. The teres major is an important muscle. There's several very important muscles behind the shoulder in the scapular area, but 3 reasons why we've kind of jumped to this. Number one is in pro sports and so much money involved in other things, they jump to an MRI immediately. So if this is a high school kid, a weekend warrior athlete, or we're not getting an MRI on day one on a muscle injury like this. And very often, okay, so you'd treat the muscle injury aggressively when they start to get range of motion, strength. We'd start them back to overhead activities like baseball and things like that. So jumping right to an MRI, and now MRIs are pretty good. You can see specific muscles. There's a lot of muscles back there. There's 8 different muscles that attach to the scapula, and I'll talk about that in a second. But the other one that I mentioned to you, sorry, about the Frankie injury and so many of these other specific muscles that we've been talking about, overtraining. Athletes are pushing it to the edge, and there's only so far you can go. In overtraining, we're seeing, and you gotta think with 6 to 8 weeks, they must have seen on the MRI some sort of significant strain, micro tear, or even frank tearing the teres major to come out and say something as significant as 6 to 8 weeks. And the other thing is, in major leagues, professional sports and Major League Baseball, there's so much money on the line that agents are involved in all these diagnoses, and for them to really hold on to a guy like this for this long with an injury, a lot of it is because of his future earning potential. So different than what we might see in my office and most of what you'd see in sports medicine. This injury would be in my office scapular dysfunction. Now, that is an injury we see a lot, and it's a fancy word, but the scapula is a flat bone behind the right shoulder, and it's triangular shaped, and it slides nice and freely over the rib cage, and there's 8 muscles that attach to it, almost like a plate sitting there, and these 8 muscles and when the muscles get out of balance at all, if you have a tear, an overstrain, or one muscle is weak, the scapula doesn't slide smoothly, and when it rubs against the rib cage, it causes pain. Sometimes one giveaway to me is pain with deep breathing. These people even have pain in the back with deep breathing. Often the other muscles around it will go into spasms, so they'll tighten up. So I think that's probably what happened with Clevenger, is the tightening up of these muscles. But then what happens when you have scapular dysfunction and these muscles are out of balance? People really have this knotting up pain when they try to do sporting activities, overhead sporting activities. And so the 8 muscles don't work well together around the scapula. Dysfunction just means not working well, and it's an injury to the scapula that we see quite frequently. But we usually don't pin it down to just one of those 8 muscles. In this case, they called it a teres major injury.
When we look at these strains, and we're hearing that word more in the last 5 to 7 years. We used to hear muscle pulls,
right,
muscle tears,
right,
and I don't know if it's just an addition to the vocabulary, but calf strains, shoulder strains, oblique strains. Why so many strains, and explain what that is?
Okay, so strain is just a general term, and like everything else, it's a spectrum. And to be very simple, a grade 1 is an overstretch, maybe some micro tearing. A grade 2 is a partial tear, and a grade 3 is a complete tear of a muscle. That's really all there is to a strain. So what used to be called a torn muscle probably was a grade 3.
Okay.
And what used to be called a pulled muscle somewhere between a grade 1 and a grade 2. But here, I mean, we get the MRI at the drop of a hat. There's a lot of money on the line. I get that. We don't have that luxury. We'd be getting MRIs every day at our office for 30, 40, 50 patients. We just can't, you can't do that. And so in certain situations when you're looking at, is this going to be treated with surgery or other things? And we get MRIs, no doubt. We get quite a few, and it's necessary. But in a situation like this, in a base player, they're getting very specific. Professional player, they're giving you the specifics of the muscle. They're calling it a strain, and then they're not really going into detail of to what extent. But when they're coming right out and saying 6 to 8 weeks, you have to believe it's probably more in a grade 2 area where there's some partial tearing on the MRI for them to say something like that.
Well, the complexity, and you described that real well, of this muscle back there with the scapula. 6 to 8 weeks. Is this the type of injury can linger, or 6 to 8 weeks of rest? Do you normally see a full recovery?
Well, that's why the 6 to 8 weeks. So in our typical world now, this person that comes into my office today, I don't get an MRI. It's a muscular injury. I call it a muscular strain, a scapular dysfunction. I see that bone isn't working well. I call it dysfunction. I press across that area. The area where this muscle sits is the area when you put on your underarm deodorant at the end of a day. In the back of that area, if you feel a muscle that sticks out there where you put the deodorant on, that's the teres major. It's the back area of the underarm, the axilla, what we call it, but it attaches to both the upper arm bone, the humerus, and to the scapula, and it actually pulls the upper arm bone in toward the scapula is what the teres major's job is.
So for pitching, that's a difficult injury.
It's a difficult injury. Now, in a lot of cases in my office, I might be telling somebody a much wider, broader, because I don't have a specific diagnosis, that this could be 4 to 8 weeks or 3 to 8 weeks or something like that. Let's just see how the muscle, and then we go about physical therapy to turning this around. And that's why some of us in sports medicine, the surgeon I talked to last night, we chuckle at coming out on day one and saying 6 to 8 weeks before you touch a baseball. Wow, that's unusual. But for your point before, we don't want this to linger. You want this guy at his best in August, September, October, of course. You want Frankie at his best in, August, September, October. So they are really sitting on a lot of these injuries to get full recovery. That might not happen in the real world of high school and athletes and weekend warriors.
Joe, great stuff this week. Thanks for coming in.
All right. Thanks, Ray. Have a great week.
You too.
Thanks.
Dr. Joe Congini, Akron Children's Hospital, joining us live. A little bit about Mike Clevenger's back muscle strain.